Welcome to Medtalks, your go-to source for health information and medical insights. I'm your host, Juvenava, and we are bringing you the latest in healthcare. Whether you're looking to understand the basics of wellness, gain practical tips for everyday health, or learn about community resources available to help you live a healthier and happier life, Medtalks has you covered. Join us on this journey to better health, and remember, a healthier you starts with a single conversation. Stay informed, stay healthy with Medtalks, where every talk is a step towards a better you.
Grace Med Health Clinic is your home for complete compassionate care. From medical visits to vision screenings, dental care, behavioral health support, and a fully equipped pharmacy, we're here to meet all your health needs. Our dedicated team of providers and staff work together to make every visit welcoming and stress-free. Because at Grace Med, you're not just a patient, you're part of our family. Call 316-866-2000 to schedule your appointment. Grace Med Health Clinic, compassionate care for all.
Welcome, guys, to another podcast of Medtalks. I am Juvenava, Director of Community Outreach and Communications at Grace Med Health Clinic. I am here with Suzanne Proctor of KDHE, who's going to talk to us about the Early Detection Works program. Hi, Suzanne. How are you?
I'm good. How are you, Javine?
Thank you. Thank you so much for joining us and for being here virtual. This is great.
This is exciting.
I am excited. This is our first episode we've ever done virtually, so thank you so much for doing this with us.
Sure. Thank you for having me.
Yeah, of course. So, Suzanne, talk to us about, for those who might not know, what is Early Detection Works?
So Early Detection Works, or EDW, is the free breast and cervical screening and diagnostic program for uninsured women living in Kansas. The goal of the program is to reduce late-stage diagnosis and mortality due to breast and cervical cancers.
Okay. So what inspired the creation of EDW and how has it evolved over the years?
So the Early Detection Works program is actually part of a national program called the National Breast and Cervical Early Detection Program, which was created by Congress in 1990. And currently there are 70 state, tribes, and territories that are granted funding to provide the services.
Okay.
Early Detection Works, it's a very, very special year for Early Detection Works. We are celebrating our 30-year anniversary.
Oh, nice.
Over the past 30 years, the Early Detection Works program has had an immense impact on Kansans. The program has served over 70,000 low-income uninsured women living in Kansas that don't have health insurance, in turn diagnosing 957 women with breast cancer and 1,686 women with cervical cancer.
Oh, wow. That's great.
It's amazing.
Yeah. So how does EDW fit into the bigger picture of cancer prevention and women's health, like across the state?
So when I think of the big picture, I think of all the women who have received breast and cervical cancer screening and treatment due to our program who would not have otherwise been able to receive the services due to not having health insurance. While not every woman is diagnosed with breast or cervical cancer through our program, participants that are diagnosed, we do have an agreement with Kansas Medicaid or KanCare to expedite their process into the Medicaid program so that their treatment isn't delayed. So they process those applications within 15 business days, which is really, really fast for Medicaid.
Gotcha. So many people will put off like screenings because they're very scared or afraid. How does EDW sort of break down those barriers?
So one of the biggest barriers we have would be funding, of course. So EDW has provided funding to pay for those breast and cervical screening and diagnostic services. We are not allowed to pay for any treatment. So we do have an agreement with Kansas Medicaid to expedite the process, like I said. So with women that have a fear of pain, I really try to identify what that fear is so we can address it. And if it's pain, I really have convinced a lot of women to go get their screening when they were afraid of pain. And, they come out of their screening and they're like, that wasn't so bad.
Yeah.
Because it really isn't so bad. And the benefit versus the risk is so much better to go ahead and get it get it done.
Well, and I'm glad that you mentioned about people might have concerns, especially with mammograms and things. What are some common myths or misconceptions that people might have about mammograms or cervical screenings?
So some of the misconceptions I hear about cervical cancer screening, which cervical cancer screening is PAP or HPV testing.
Hmm.
A lot of times, or what I hear about that is it's only needed if I have multiple sex partners,
Mm.
or it's just needed if you have an STD issue. It's just STD testing. Or after a certain age, you no longer need to receive cervical cancer screening,
Yeah.
which none of those are true. It's really an individual choice that you need to discuss with your provider to determine what's the best course of action for you.
Hmm.
As far as mammograms go, I do probably hear a little bit more misconceptions when it comes to mammograms. And the number one is that they hurt, so why would I get one?
Right.
The other, I also hear that they're not necessary,
Mm.
and that, or why would I get screened just to find out that I have cancer that I can't take care of because I don't have any health insurance?
Yeah.
So like I said, I've convinced many women to go get their mammogram when they were hesitant, especially because they were afraid of the diagnosis or they were afraid of the pain.
Mhm.
But like I said, they come back and they're like, that wasn't so bad. Thank you
Right.
for talking me into doing it.
Yeah. Well, that's good. That's good to know. One of the things that I've seen through my experience, especially with healthcare, is that access to healthcare is different depending on areas where a patient might live. Do you see, differences in access across the state, especially in rural and urban communities for screenings?
Actually, when we look at the breast and cervical screening across the state of Kansas, we don't see major differences between urban and rural areas.
Okay.
But we do notice that many people in rural communities who could benefit from the EDW services aren't reaching out.
Hmm.
That's why it is so important for us to meet people where they are.
Hmm.
Whether it's at a community event, at a health fair, at a county fair, or other gathering, we go to them instead of them coming to us.
Okay.
We want to attend those events. We also look at our program's reach. So we see that we're connecting more people in the metro and urban areas with the services than those in the rural areas. This really underscores the need to be visible and present in rural counties in Kansas. So this will, because if we can gain access into those counties and build some trust,
Mhm.
it's going to bridge the gap and make screening across the state truly equitable.
Is there a cost to receiving these services if they do qualify for EDW?
That's a great question. Early Detection Works provides breast screening starting at the age of 40, and it goes to 64 with the thought that at 64 you're going to obtain Medicare, excuse me. We pay for clinical breast exams, mammograms, ultrasounds, and breast biopsies.
Hmm.
On the cervical side, we start screening women at the age of 21 and go to 64. Those services include PAP, HPV testing, a colposcopy, which is a biopsy of the cervix. Sometimes there's some other diagnostic services that are needed there to render a diagnosis. And so those are kind of isolated incidences that we look at from a clinical perspective. And if the testing is needed to rule out the cancer, then we're going to pay for it. But we are not allowed to pay for any type of treatment.
Okay. How many people have you how many people have you seen receive the screenings through EDW? Like what are the outcomes like?
So in calendar year 2024, EDW served over 7,700 women.
Okay.
This includes both breast and cervical services.
Wow.
Over the past 30 years, we've provided over 350,000
Wow.
breast and cervical screenings to Kansans.
That's
So,
incredible.
yeah.
I can imagine that you probably get to hear some stories or see the impact through people sharing their experience or what EDW means for them. Obviously, without sharing any kind of like personal information or anything HIPAA, is there a specific story that really gives you the example of how EDW works, like the impact that it had in someone's life that you wouldn't mind sharing?
Sure. And I'm going to kind of make that into a lump. So I I have to say that women that reach out and are enrolled in our program and then diagnosed are so grateful. I can't tell you, it's an emotional conversation a lot of times because they are so grateful, because they just don't know how they would address a cancer. I mean, without some type of help. A cancer diagnosis involves a whole lot of stuff. It's not just the healthcare you're going to receive; it's the time away from your family and work that it takes you away from. So it's a very emotional, um, it's a very emotional diagnosis, and it's a very emotional time for these patients. And I can't tell you how grateful they are, and I can't even tell you how many calls I've received of women that were said, I don't know what I would have done without you.
Mm.
So it feels good, and I like to tell my nursing staff that this is a feel good job because we
Mhm.
are helping. Very rarely are we not able to help someone. So it just is great. It's a
Yeah.
great program.
Well, I know for Grace Med, we're incredibly grateful for the work that EDW does. We've heard some great stories as well about the impact that EDW has had for some of our patients. Um, so that's to my next question. How do partnerships with health centers like Grace Med help extend EDW's reach?
So EDW really depends on our partners and providers to spread the word about the program. EDW contracts with a provider in almost every county of the state. And
Mhm.
so one of the barriers that we've identified is transportation. The thought is the more providers we have throughout the state, the less the transportation is required. And so we're breaking down that transportation barrier. Um, a lot of times it's word of mouth. We ask everyone to share EDW with everyone they come across. Um, the more EDW providers we have offering those services, it's going to break down that transportation barrier for that patient to get to the service, which in Kansas, as I said, we have identified transportation as a big area, a big barrier. GraceNet is a wonderful partner as well. You guys serve a whole lot of patients that would not be receiving care if we didn't have GraceNet as an option. So thank you.
Well, I appreciate that. I mean, I know this is a very collaborative relationship, and it's a relationship we have with a lot of partners. And a lot of this stuff has to happen through educating like our patients about the importance of these things. So, speaking of education, how do you approach educating the community about the importance of early detection, especially among groups who may not prioritize preventative care?
That is a very big challenge.
Mhm.
We have found that meeting people where they are instead of expecting them to come to us is basically key. We also work with culturally appropriate organizations to reach communities who do not have trust in the healthcare system. So we like to go to them. We like to meet them where they are, where they work, live, and play, and just try to build trust in that community and almost become a part of that community. If you live there, it's one thing, but if you're just visiting, you're coming into a community to help them, it's not a one and done. You've got to work with the folks in that community to build some trust.
Mhm.
And so we work really hard to build trust in those communities so that we're invited back, number one, and so that they're happy to spread the word about our program.
Yeah. When I think of like breast cancer, I think of obviously October because of Breast Cancer Awareness Month. And we see like a lot of pink, which honestly, I love pink. So I'm all for it. How does EDW use awareness months to move beyond awareness into action?
Just so you know, I love pink too. Um,
Out by your
and
shirt.
yeah, exactly. We are very busy in October, as you can imagine. We are busy with providing education, attending events, enrolling patients, etc. Again, we rely on our partners to help spread the word about the EDW program. I personally have a goal before I leave the EDW program to make sure that every nurse in the state knows about our program. I don't know why. EDW is an amazing program, but it seems like it's like the best kept secret in the state. We don't want it to be a secret. We want everybody to know about it and everybody to benefit from the program who qualifies.
Right. Yeah. So looking ahead, thinking about the future, what do you see as the biggest challenge ahead for cancer prevention and screening programs like EDW?
I'd have to say the biggest challenge is funding,
Mm,
right?
yeah,
If without the funding, we can't provide the service.
right,
And we don't have any control over that. So
right.
it is a tough one. Um, I would also say that it's getting the word out, right? Why is this a secret in this state? Hopefully this podcast will reach at least one person who can benefit from the program. At least one, but I bet there'll be more.
Oh, that's what we're going for. I mean, and that's the goal of this is for people to be aware of resources and services that are available for them that perhaps they didn't know about.
Right.
And so I'm really glad that we're able to talk about this. If you could tell every woman in Kansas one thing about their health, what would it be?
I would have to say two things. I would have to say, number one, put yourself first. As women, we tend to put everybody else and treat ourselves best last. Um, what I like to tell people and what I tell my own children is if you are not okay and well, you cannot be a help to anyone. So you've got to take care of yourself first. That doesn't mean that you don't take care of anybody else. That just means you put yourself first to make sure you're good before you move on to help somebody else. The other thing I would say is be a strong advocate for yourself.
Mm,
Um, Listen to your body, ask questions when something isn't right. And there is absolutely nothing wrong with getting a second opinion.
mm. So for our listeners who want to help spread the word or get involved, what's the best way they can do that?
Reach out to EDW. If you're having an event in your community and would like EDW to be there, we're happy to come. We bring a few goodies and we have pink. And we love to visit with the community and that helps us get the word out. It also helps us meet providers that maybe don't know about the program that would their patients would benefit from.
Yeah. Well, I'm
So I
glad.
want every woman in the state to get screened, regardless of their ability to pay.
Oh, definitely. I completely agree with you. I know we have a couple of events that we're planning that I would love for you to attend and be a part of, because we definitely want to help spread your message and the resource available.
Thank you. We'd love to be there.
Well, Suzanne, thank you so much for your time and for talking to us and for giving our listeners an opportunity to really learn about EDW. I really appreciate it.
Oh, I really appreciate you reaching out. And anytime you need anything, give us a call.
Well, thank you. Thank you to all of our listeners too for listening. If you want more information, visit gracemed.org, and follow our podcast link, and we will see you there. Talk to you later, guys. Bye.
Thank you. Bye.